Hello, my name is Lydia Young, and I'm a research analyst at Toronto Rehabilitation Institute, which is part of the University Health Network. As part of our Research Digest series, I will be presenting a few research studies from our Enhancing the Care of the Older Adult, or ENCORE, team. Today, we are summarizing Impact of Dementia on Patterns of Home Care after Inpatient Rehabilitation Discharge for Older Adults After Hip Fractures by Catherine McJilton et al. The keywords for this article are hip fractures, dementia, older adults, aging, and long-term care. Research questions. This study looks at older adults with dementia and without, with hip fractures. It is especially interested to see what happens to these older adults 30 days after discharge from a rehabilitation unit. The study asks, how many people received home care after rehab? What was the percentage and number of different types of home care services they received? What were the sex differences in the patterns of home care services? Why is this important? Older adults who received home care services after discharge from inpatient rehabilitation for hip fracture are less likely to be hospitalized again. They have fewer nursing home admissions than those who receive inpatient rehabilitation only, with no follow-up services at home. However, there are no principles that provide guidance on what home care services are required after inpatient rehabilitation. Background: older adults with dementia are vulnerable after a fracture-related hospitalization. They have complex care needs with risks of becoming more ill. Disparities exist in the provision of rehabilitation care and services for people with dementia. First of all, only a small number of people with dementia gain access to inpatient rehabilitation. Men use home care services at a lower rate than women. However, women are less likely to receive referrals to home and community supports from healthcare specialists, even when they may have higher needs. Methods. The study used a population-based retrospective cohort approach. It looked at health administrative databases from Ontario, Canada. Definitions. Retrospective cohort. A type of study where information is collected from medical records or health data. Using this information, groups are compared over time and on particular health outcomes. Health administrative data. Health and health-related data that are collected for administrative or billing purposes, but can also be used for other purposes including research and to track measures of population health. Rehabilitation. The action of restoring someone to health or normal life through training and therapy after illness. Population. The cohort group consisted of 17,263 older adults admitted to inpatient rehabilitation with hip fractures. The average age of the group was 83 years, and most were women, 73.3%. 14.4% of the cohort had dementia, 14.1% among men and 14.5% among women. Compared with those without dementia, older adults with dementia were more likely to receive home care services, 87.0% versus 79.0%. Percentage and numbers within 30 days of discharge from inpatient rehabilitation. Physiotherapy. People without dementia had more visits, 56.2%, compared to people with dementia, 55.8%. Personal and or homemaking. People with dementia had more visits, 66.1%, compared to people without dementia, 46.4%. Occupational therapists. People with dementia had less visits, 37.4% compared to people without dementia, 45.3%. Sex differences within 30 days of discharge from inpatient rehabilitation. A previous diagnosis of dementia was linked with use of at least one home care service after discharge in both men and women. The estimates were higher for men in the personal and/or homemaking services category than for women. Both men and women with dementia receive more personal and/or homemaking services compared with those without dementia. Conclusion: among older adults with hip fracture who were discharged from inpatient rehabilitation units, those without dementia received home care services more often than those without dementia. Most of the services received after hip fracture are from personal support workers. Patterns of use are similar in both women and men. The study recommends occupational therapists and physiotherapists be available to all adults, including those with dementia. Please visit our website at www.encoreteam.com, where you can learn more about the Research Digest and find a PDF version. If you have any questions or require more information, please email us at ellen.snowball@uhn.ca.